And we're spending time with Dr. Kalpana DePasquale, and we're going to talk today about tonsils and adenoids. That's kind of a flashback, Dr. DePasquale, to our youth, right? When there was always the constant threat that we would have our tonsils ripped out.
And it was so much worse back then than it is now.
Why is that? I mean, I was a kid in the 60s, and there was always this, every time I'd get a sore throat, there would be some adult that would come around the house and say, you need to get your tonsils out. It's like, I get a stomach ache. Nobody says I had to get my stomach ripped out. What's with this thing that everybody wanted to rip my tonsils out of my head?
Well, it was so funny because years ago, that's, if you got an infection, it was standard operating procedure. You got your tonsils taken out, end of story. But these days we have much more stringent criteria about why we remove tonsils.
Dr. Kalpana DePasquale is the founder of St. Augustine Ear, Nose, and Throat with 2 locations here in St. Johns County, both, of course, on State Road 312, just over the bridge on the other side of the Intercoastal on the island, and also up in the Ponte Vedra Nice High School area near Nocatee off of US 1. You can learn more by going to saent.net. So first, help me out with the basic anatomy lesson. I'm standing, I look at myself in the bathroom mirror. Where are my tonsils?
So the tonsils are in your mouth, just located on either side of the back of your tongue. So you'll see these two structures. Usually they're not, if they're really large, you can see them jutting out. But a lot of times they're not that large, so they may even be difficult to see in some people.
If I take my toothbrush and I use it as a tongue depressor, like you have that snazzy device in your office, and I go, will I see them?
If we don't know how big yours are, but most of the time you can't see them there. The
And
bigger
where
they
are
they're right back in your throat. So
what do
basically,
they look like?
They're like little balls in the back of your throat.
Really? So I was told, by other kids on the playground back in the day that they're useless. So you can go ahead and just cut them out because they don't do anything.
So that's sort of somewhat true.
Wow.
Obviously they do provide some defense in immunology, but it gets to the point where if you're having repeat infections, whatever benefit that would have created kind of goes out the window at that point.
So how would they have provided some benefit for immunology?
So basically some antibodies are created within the tonsils. And, so people say, oh, my God, if I get my tonsils taken out, will that mean my body can't fight infection? And the answer to that is no, because that is one line of defense for your body to provide a defense. But we have others as well. So it won't make you sicker all the time.
Now, back in the 60s, you know what the ultimate reason to get your tonsils out was? What you would be told by all adults and parents?
What was it?
You can eat all the ice cream you want for as
right.
long as you want. That was sort of before the day of childhood obesity.
That's right. Well, and it's actually not the best thing to eat after a tonsillectomy. So I usually will counsel my parents and no, don't feed them all the ice cream they want.
Right. And I would guess maybe that's because of why there could be bacteria and other things in the ice cream.
It's just that it's dairy. So what it does is it creates this thick coating in the back of your throat, and it just makes it uncomfortable. So we prefer more clear type things like soups and popsicles and things like that.
Dr. Kalpana DePasquale, we're talking about tonsils and adenoids today, and very interesting stuff. So the reason I guess some doctors, even some doctors, but also I guess a lot of adults that didn't know any better would always say, oh, well, Kevin needs to get his tonsils out when he was a kid, was because I'd have sore throats a lot of the time. When is the appropriate time, and what brings about the need to have your tonsils removed?
A couple of things that we look at when we're talking to parents and children about a tonsillectomy. Number one would be how many infections a year are they getting? And are they getting antibiotics for each of these infections? Then how long are these infections lasting? Are they missing school? So those are some pertinent details that we would dive into.
Okay. So maybe over a period of a couple of years, just constant,
Yes, usually
issues.
It's about 5 to 7 that we're looking for.
Right. Okay. All right. Wait, when we come back, say the decision has been made to remove tonsils, what's that procedure like and how can it be done? And can it be done at St. Augustine Ear, Nose, and Throat? Short answer to that is
no.
All right. But we're going to learn more, so stay tuned. We'll be right back with Dr. Kalpana DePasquale. In the meantime, check out her website at saent.net. We'll be right back. And we're back with Dr. Kalpana DePasquale. She is the founder of St. Augustine Ear, Nose, and Throat and the Avanti Medical Spa. 2 locations here in St. Johns County over on the island, just off of the 312 bridge there, and also in the Nice High School area in Ponte Vedra and that part of the world right off of US 1. Very convenient for our listeners. Check out the website, saent.net, saent.net. And today we're talking about tonsils and adenoids. And in the previous break, we were just talking about how, children get these issues with tonsils? Is it always children? Do adults ever get problems with their tonsils?
Adults definitely have problems with their tonsils as well. I see both.
Now, I was told as an adult you absolutely can't have your tonsils out because, they'll be like, I don't know, like you'll grow another head or something.
And that's absolutely not true. You can. It's just, I would say it's easier for children than it is for adults. I mean, they get to lay around and do nothing, and we have obligations. So it's definitely a little harder, probably a little more painful, I think, as an adult than a 3-year-old would have a problem with it. So, it's not that it can't be done.
What's the most common age for children here in St. Johns County to get their tonsils removed?
Really, there is a lot of times it's more the adolescents, when they're in school. Many of them are missing so much school because of their tonsillitis episodes, and that tends to be a big one. So we see a surge of tonsillectomies around, Christmas time and the summer break because that's when the kids are out of school.
So a tonsillectomy or the removal of tonsils is not going to happen at your offices there at St. Augustine Ear, Nose, and Throat, but it's going to happen probably where?
At the surgery centers, because that's the ideal location for these kind of procedures. They're pretty quick, and, you come in about an hour before the procedure. You have the procedure done. It takes about 45 minutes or so. You hang out for a little while, demonstrate that you can drink some liquids, and head on home.
Okay. What's the typical outcome? So people that have a tonsillectomy, they get their tonsils removed, and beforehand they were getting these constant infections. You see some pretty dramatic results?
Yes, because once the tonsils do not exist, you can't get tonsillitis anymore.
Boy, that's pretty good. Boy, that's a medical outcome even I can understand. Once they're gone, they're not a problem any longer.
That's correct. But I do tell patients that you can still get a sore throat. You can still get pharyngitis, but you will not get tonsillitis.
Okay. So people have been diagnosed, maybe they've gone to an urgent care center, maybe they've seen a family doc and they're in the process of moving, and they've been diagnosed as having an infection in that area or having some tonsillitis type issues. How often should that happen over a period of time where it really does become an issue where you consider having them removed? I mean, should this be something that happens every other week in the wintertime, or is it something that happens, once a winter? I mean, what's the standard, if you will?
So that's a really great question. I mean, most of the people that we see, some will get it every 2 months, like clockwork. Yeah. Others will have an increase in their infections, maybe in the winter time. So each person's case may be a little different, but what we look for is the total number of infections in one calendar year.
Okay, and that magic number is
around 5 to 7. If somebody's really being affected, so even that. I may do it at 5 if somebody has, if they're missing months of school because of each infection, they're out for 2 weeks. It really depends on the severity of their symptoms, too.
When a child has an infection of the tonsils, are they contagious?
Well, they're just a bacterial infection, so it certainly can be contagious, usually, especially in the febrile period. And then later after they've been treated, usually after 24 hours, they're not determined to be contagious anymore.
Did your sons make it to adolescence with their tonsils intact?
One has them and one doesn't.
Isn't that interesting?
Yes.
So one had, was it your younger son or your older son?
My older one had his tonsils out.
Okay. And so he met that standard of having more than 5 infections in a calendar year.
Yes. And, it was a really interesting scenario because I was actually a resident when he had his, when he was having all these problems with his tonsils. And literally he was sick all the time. It was one after the other after the other. And I had given him antibiotics after antibiotics after antibiotics. And the funny thing was that's what they kept recommending, more antibiotics. But luckily, I was an ENT resident, and I knew that these things needed to come out. And every time we gave him antibiotics, then he had problems with the antibiotics, like vomiting, et cetera. He couldn't keep weight on. I mean, it was a difficult time.
Sure. They were removed, and he got all the ice cream he could eat. No. Did he get to at least lay her out for a day or two?
He didn't have any problems with it. And
Really?
that's why it's easier when they're young, because he was about 2 when he had his tonsils out. And it's amazing. He just sort of bounced back. He wouldn't take the pain medicine because he didn't like the way it tasted. And we thought it was going to make him a little tired and a little easier to manage, but no, it didn't.
Wow. Well, there's a good personal story of how that all worked out, and it's, the vast majority of the time works out very well for people, doesn't it?
Yes, it does.
Yeah. Well, once again, if you have any questions at all about issues relating to tonsils, obviously, you would want to go to St. Augustine Ear, Nose, and Throat. And, of course, you can learn more by going to saent.net. That's saent.net. That stands for St. Augustine Ear, Nose, and Throat, obviously. We'll be right back with Dr. Kalpana DePasquale. And we're back with Dr. Kalpana DePasquale. She is the founder of St. Augustine Ear, Nose, and Throat right here in St. Johns County with 2 locations over on the island, just over the 312 bridge across the Intercoastal, and also in the Nice High School area in Ponte Vedra right off of US 1. And you can schedule a consultation and meet with her or a member of her team at either location. Just check out the website, saent.net. That's saent.net. Dr. Kalpana DePasquale, we've been talking about tonsils and adenoids, mostly about tonsils. Now we're going to talk about adenoids, another thing that every adult in my life in the 1960s said should be ripped out of my neck. But I will tell you, as I sit here at 51 years of age, I have them all, tonsils and adenoids.
Well, that's fantastic.
I don't know if it is or it isn't. Adenoids. So give me the basic 10th grade anatomy lesson. Where are they in my body?
So adenoids are lymphoid tissue, just like your tonsils, except they're located in a different area, behind your nose, sort of above your soft palate, in a place called the nasopharynx.
What do they do?
So same thing, it's lymphoid tissue. They do provide some immune function. But again, it gets to the point where if they're large and it becomes hard to breathe through your nose because they're so large, or if they get frequently infected, it could be a problem as well.
Right. Why do you think we have them?
That's a really good question. I don't know if I can answer that one.
Speculate. You're the smartest person in the room.
I think that, at one point it used to provide more immune function, and, we just have other methods of immunity that we have. So bottom line is who knows if we'll evolve into not even having those structures anymore because we wind up removing so many of them.
Right.
Who knows? I mean, it would be interesting to see.
Kind of like our appendix.
Exactly.
That issue.
Exactly.
So what are the typical problems that we have with adenoids, and at what age typically?
So problems can occur at any age, but typically they start to regress in size as people enter puberty. So typically adults usually don't have them, but some do. I mean, there's always somebody who does have them. But bottom line is when they become so large that they're either creating recurrent infections or causing difficulty breathing, contributing to sleep disordered breathing, that's when removal should be considered.
Okay. All right. If they are removed, is this a more significant procedure than having your tonsils removed, or not so much?
Actually, no. I mean, the adenoids are much less uncomfortable than tonsils are. Basically, you may just feel like a little burning back there or something, but typically people will improve in just a few days, and it's not so dramatic.
Okay. And is it the same deal where it's normally younger people, children, or, what's the typical age where someone would have their adenoids removed?
Yes, typically it's much younger children for the adenoids. We do it sometimes in adults as well, but it's much more rare.
Okay. All right. And if adults, what is it the same sort of deal in terms of when an adult might need to have their adenoids removed? What are the typical problems that you're trying to fix when you remove their adenoids?
The same exact thing as with children, for recurrent infections, if it's blocking their nasal breathing, if it's contributing to some sort of sleep apnea picture, all of the same reasons.
Okay. All right. And once again, if people are having any of those issues, they should get in touch with you, seek a consultation, right? And you'll kind of go from there.
That is correct.
All right. Well, you can do that very easily by going to the website, saent.net. That's saent.net. We'll be right back with Dr. Kalpana DePasquale. And we're back with Dr. Kalpana DePasquale, once again, the founder of St. Augustine Ear, Nose, and Throat. She founded that practice, gosh, how many weeks ago now?
In 2003. I don't know how many weeks that is.
That was a long time ago.
A very long time ago.
Dr. DePasquale, it's 2016.
Exactly.
You did that in 2003, way back then.
Way back then.
Yeah. She's still looking good. Still looks like she's 21 years old and in med school, right?
I think you need glasses, Kevin, but thanks.
Hey, we're spending time today talking about tonsils and adenoids. And, of course, if you have children, or more likely if you have grandchildren or nieces and nephews or neighbors' kids, and they have experienced a variety of infections during this winter season. Hey, by the way, does that happen more in the winter, or is that also an old wives' tale?
It typically does happen more in the winter. It does. I mean, we definitely see an increase in tonsil infections and nosebleeds in the winter. That's what we can expect.
Not to branch off too far away from tonsils and adenoids, but there's been like this little debate out there about, do you really catch a cold from being in the cold?
Yeah, I don't know if that's really true.
Yeah, most medical professionals say it's not,
yeah,
right?
I don't think that's true at all.
Remember how your grandma would say if you went out, you had to have a really heavy coat on and gloves.
Right.
Otherwise, you would what?
Catch a cold.
See?
Yeah, I go out and run when it's like 40 degrees, and I'm pretty good. So I don't think that's true at all.
We're going to get that dealt with. So we're talking about tonsils and adenoids, and of course, after a period of maybe having 4 or 5 or 6 of these infections during a calendar year, whether relating to tonsils, tonsillitis, that sort of thing, or your adenoids, it is sort of the accepted practice that they would be removed.
That is correct.
All right. So with that said, surgery. What's the process there? How do you get ready for it? How long are you going to have to, recover? Let's talk about that a little bit.
So basically, as far as getting ready, depending on the age of the child, we have to get some blood work done. Obviously, we have to schedule the surgery. The surgery, as I mentioned before, takes about 45 minutes. After the surgery, about an hour, you have to remain in the surgery center just to make sure after observation, everything looks great. Then you go home. The period usually is about a week for most people. And as we get older and the adults, I'll tell them it could take a week to several weeks for full recovery.
I would think as an adult, like if I go in and get my adenoids removed, I'm milking this.
Probably.
I'm going to like limp to the chair. Even if I'm feeling better, I'm going to be like, come on,
And remember, adenoids are less painful than the tonsils, so you should be recovered pretty quickly from that.
Now, is there any way to work a deal with you where like you would tell our caregiver, that it's going to be a little bit longer on the recovery period than it actually is? I mean, are you open to that?
I don't think so. I'm going to tell them the truth.
She's always honest.
You're not milking anything.
Oh, man. Well, once again, though, it's something where if people are experiencing this, especially young people, children, adolescents, these infections time and time again are just not good for a variety of reasons, right?
Correct. I mean, obviously, people are missing time out of work or school, and, it becomes an issue. It becomes an issue even for children, for the people who are taking care of them. Sometimes the parents are missing a lot of work because the kids are out of school. So a lot of different factors play into this.
Well, if you have any follow-up questions about tonsils and adenoids as they relate to children, adolescents, and even adults, we encourage you to visit the website saent.net, saent.net. If somebody in your circle of friends, a family member, somebody that you're just in touch with, they're experiencing a lot of problems or issues or constant infections and challenges, that's the time to get a consultation.
That is, absolutely.
And we encourage you to do that. You can do that through the website. You can also call St. Augustine Ear, Nose, and Throat. Both offices here in St. Augustine and Ponte Vedra also have the same telephone number, 461-6060, and very easy to remember telephone number, 904-461-6060. Dr. Kalpana DePasquale, we learned a lot this morning. Thank you very much, and we'll look forward to talking with you again soon.
Thank you. Bye-bye.